So there is a lot of hard work ahead. And unfortunately, to build these types of tools at the level of polish that you need to make it, it is very expensive. But there are ways to begin to cut that cost eventually. So when you look at this conceptual framework, when you look at this conceptual framework, you can see that, one, I always ask myself, there are many professors now that I'm building apps with from many different universities. They have a specific problem. For example, why are we filming patients, neuro patients? Because without watching how neuro patients move and how different neuro patients and different types of impairments like spasticity or ataxia, by filming all of those examples, it gives meaning to all of your PNF and your NDT and all of your interventions. We don't have that. It's very difficult to do that, but it's a critical piece of helping students learn. So today we have 3 neuro patients coming in: traumatic brain injury, Parkinson's, ataxic, and a stroke patient. We're filming all of them doing functional movements, bed mobility. So the next question you have to ask yourself is digital media the optimal solution, right? So can I write a book? Should I write a book? Or is the visual, the videos, the ability to infinitely link, right? Why I stopped writing books, my first book, my second book, is because they were always trapped in chapters. It did not solve my problem. So digital media to me was the optimal solution. Now you also have to ask yourself, do alternative solutions already exist? Well, yes. Actually, I have some colleagues and friends who have made some amazing orthopedic special test and manual therapy apps. That's why we did not build that. They did that. It's great. It didn't solve the problem I was trying to solve. I needed to create a logic-based roadmap that helped students to develop patterns of practice, examination, treatment, therapeutic exercise, the whole pattern. So we did that for cardiopulm. We did that for ortho. We're building things for wound care, neuro. So the question then is, when you've decided, yes, I think that this is the right medium, the alternatives don't really exist, therefore I can build it, I should build it, you have to then decide, what do I need to build? And is that attainable? Can I get patients to come in to film them? Do I have enough time to film and patients to film all of the techniques I need for my class, right? That in of itself is a monster considering how overloaded we are. And you'll see for many of our apps, there's a very careful review of the literature. We spend a lot of time figuring out guidelines, research, making sure everything is cited. And so there's a massive, this is not just making Angry Birds, which we would be much richer doing that, but we are trying to make sure that the stuff that we build can stand the test of time, can stand the scrutiny of our own students and our own colleagues. Then eventually you have to develop a mock-up, and I'll show you how we do that. Right now, for many of these apps, we are in the generation of digital media phase. So we are filming, there's editing, there is typing for all the data that you need to get in there. This phase is easy and fun. This phase is absolutely brutal. Okay? And then there's a beta testing phase. So what you see, and then eventually after beta testing, so what you see here is our beta testing site where we basically launch new apps. You can see patient education we just finished. A special test app, we haven't even finished adding the icon to it. Basically, this is where we test everything in-house to make sure that before we release it, it's solid. Right? So here are a couple apps you guys have not seen yet. So there's a beta testing period, and then there's the worldwide release. So this is a scary time. Think about throwing your work out onto the App Store, and the moment something crashes, the moment someone doesn't like the way you presented things, the 1-star reviews start rolling in, and you're dead. It's done. All that work. So there is a lot of risk. But above that risk comes a passion to change how we teach and learn, that the risk does not even matter. It's not a risk that I worry about at all, because the previous versions of how I do things can be done so much better. And I would say that there is probably a year-long period of refinement, real-world testing, feedback from your students, from other professors. This is where your product, your app becomes refined. We begin to get feedback. I mean, Tony has given us great feedback. We have many colleagues, Eric out of Northeastern, who sent us, hey, we need this, we need that, and we would go in and film it and add it to these apps or create new apps.